Hi, Ms. Typodont. So today we did some assessments on your teeth. Let's go over your oral health routine and we're going to find out where we can make some improvements. So to start off, I see that you have a high sugar diet and that you do currently smoke. So both of these are going to contribute to the overall amount of plaque or bacteria that's in your mouth. And I want to go over what this bacteria can actually do for our health. So, cavities and gum disease, they're caused by the bacteria in your mouth or plaque. But the bacteria that makes up the plaque, it can eat through the layers of your teeth, it can eat through under your gums. It can cause things like bad breath, pain. It can eventually lead to the loss of your teeth if it's uncontrolled. And it can even get so bad that it can spread through the bloodstream and cause systemic health issues. It can spread to your heart and your brain. So it's really important that we cut down on the bacteria in our mouth to prevent further issues. So let's talk about why your oral health routine is important. Your oral health routine, where you brush your teeth, and the products that you use, it can cut back on that. But things like your diet and tobacco use can also contribute to it. And I see that you do have a high sugar diet and that you do smoke cigarettes. So these are going to contribute to that. The sugar is basically what the bacteria feeds on. So a lot of sugar, and it's going to stay on your teeth. So a lot of sugar on your teeth is going to increase the amount of bacteria because it has a good food source. The tobacco is going to cause dry mouth. It can also cause some other issues like oral cancer. But the dry mouth can lead to bacteria because it's decreasing your salivary flow, so it's not able to wash away that bacteria. So it's allowed to just kind of sit on your teeth and just kind of multiply. So some things that we can do so far in regards to your diet and tobacco use. With your sugary diet, I would, if possible, switch to a low sugar diet. It's gonna cut back on that sugar. You can also use alternatives like xylitol is a really good one. It's actually been shown to decrease the amount of cavities. Um, and it also tastes sweet. So if you need that sweetness in your diet, I would look into xylitol. It's a safe sugar alternative for your teeth. Some other things you can do is if you're eating and drinking anything with sugar, try to do it all in one setting. That way you can just get it done and then you can rinse afterwards with a mouth rinse or even some alkaline water so it doesn't contribute to the acid in our mouth, instead of just snacking throughout the day. So those are a couple of simple ways to cut back on that sugariness in our diet that might be contributing to the bacteria in the cavities. With the tobacco, ideally you do want to quit, or at least if you can reduce it, that might help. Some dry mouth rinse can help with that salivary flow. I also see that you take medication for seasonal allergies. That usually does cause dry mouth as well. So a dry mouth rinse throughout the day as you need can help with that as well. Um, so some other things I'm going to recommend in regards to like your toothpaste and your mouth rinse, I would get something with fluoride. Fluoride, it helps kill the bacteria in your mouth. It helps build back our teeth and strengthen them. It does what's called remineralization, which after the acids and the sugars kind of wear away the enamel, it helps bring back important nutrients that helps build back those the enamel layer in your teeth. So it's also really good for you. And I see your current oral health routine is that you brush once a day, you don't typically floss, and you use a mouth rinse sometimes when you feel like you have bad breath. So some minor changes, I want you to increase brushing your teeth to 2 times a day, preferably morning and preferably at night. With a fluoride toothpaste like I had just talked about, and also replacing the mouth rinse you already use with one that's for anti-cavity. So that one is going to contain that fluoride like we've been talking about. Another thing that I want you to do is introduce a dry mouth rinse as you need throughout the day. So this is going to be separate from the one you use morning and night. This one is just going to be used as you need whenever you're at work, you're in the store, anywhere. If you feel like your mouth is a little dry, just use a dry mouth rinse. Act makes a really good one that I like. For the fluoride-based mouth rinse, I like Listerine Total Care. Of course, you're perfectly able to shop your options. Just make sure it has fluoride. And now on to our oral health instruction. I'm going to show you today a really good technique of brushing your teeth. I don't know if you're aware that there are multiple techniques. I wasn't when I first started, but let me tell you about one I really like. So today I'm going to talk about the modified base method of brushing your teeth. You're going to want to do it with a soft bristle toothbrush. Hard bristles can kind of scrape up your gums and your teeth layers. So let me get into how we go about it. So with the modified base technique, you're going to take a toothbrush and instead of placing it perfectly parallel, you're going to angle it 45 degrees and you're going to aim it to that gum line. You ideally want those bristles to kind of get right under the gum line because it's going to sweep all the plaque and debris out from under there. So you're going to place it 45-degree angle. You want to feel those bristles right at the gum line, and then you're going to kind of vibrate horizontally. So you're not moving it, you're vibrating. And you're going to do that maybe like about 10 different times. And then you can move on to the other section. You're going to want to make sure that you're overlapping, and you're probably going to be getting about 2 to 3 teeth at a time. And you're going to do that per section of your teeth all the way around. And you're also going to do it and the other side of your tooth as well. Now to complete this motion, after you're done vibrating, you're going to roll the toothbrush down the tooth a few times. This is what's going to clean the surface of your tooth. That way you're getting all that plaque. So vibrate, roll, vibrate, roll. You're going to want to do that a few times to make sure that you're very thorough. Another thing is the chewing surfaces of our teeth, as you can see and you can feel, that they have a lot of indents, a lot of pits and fissures as we call them. You're going to want to put that toothbrush right up against that chewing surface and just a back and forth motion, section by section, to make sure you get them all. Another area that I haven't really gone over, these teeth, they're more curved behind. So when you're doing the vibrating, you're going to want to place your toothbrush vertically. Same motions, 45-degree angle, vibrating horizontally and rolling, but it's just slightly different than those back teeth. All right, and then to finish this off, I know your main concern is about your bad breath. So one thing I'm going to show you that's really going to help you is you're going to want to do this every time you brush your teeth. Brush your tongue too. So I made a little fake tongue, but you're going to want to take that toothbrush and put it kind of in the middle of your tongue, and you're going to want to brush from back to front. You don't want that bacteria and plaque to get further back there into your throat or anything. So back to front, and do that until you cover your whole tongue. That's really going to cut back on that bad breath you may have been experiencing. It's going to help reduce the overall bacteria in your mouth. So it's going to help with the cavities, the gum disease, anything like that. If you don't have, if you do have a tongue scraper, I would prefer you to use that tool. But if you don't have one and you don't want to go out to get one, I think the toothbrush would work just fine. Another thing, that this is a manual toothbrush technique, but ideally, because I know you have been experiencing some arthritic pain in your right hand, I would actually recommend an electric toothbrush. That one, the good thing about electric toothbrushes is that they do a lot of the micro movements for you. So you don't experience as much fatigue or strain. It kind of oscillates, rotates, spins for you, and it does a lot more movements than you can do with manually brushing alone. But if you don't want to go the electric toothbrush route, I totally understand. They can be a little pricey, and maybe you just prefer the manual toothbrushing. So in that case, I would recommend this modified base technique. You can also find that on my oral hygiene instruction website that I showed you earlier. All right, if you have any questions, just give me a call.